Hello and good day, everyone. I'm Dr. Linda Bavisodo, presenting on behalf of the authors and ACMCRN. We'd like to thank the meeting chairs and committee for the opportunity to present our work today in this forum. Our abstract is entitled, Harnessing Artificial Intelligence and Machine Learning in Rare Diseases, Living with Arachnoiditis. Arachnoiditis, as you all know, is a rare and painful disorder resulting from inflammation of the arachnoid membrane surrounding the spinal cord. Very limited research exists on the symptomology, accurate diagnosis, and patient-reported outcomes in arachnoiditis, hindering effective treatment and management. Recently, artificial intelligence and cloud computing offer promising opportunities in rare disease research, enabling data analysis, pattern identification, and global collaboration. Between 2021-22, the ACMCRN collaborated with the Stuff That Works platform to implement a survey among our members, utilizing AI and cloud computing techniques to gather what is, to the best of our knowledge, the largest patient-reported survey on arachnoiditis. This study aimed to assess treatment effectiveness, provide a platform for patient experiences, and improve understanding of the condition. By leveraging technology and patient participation, the study sought to enhance patient care, treatment outcomes, and overall knowledge of arachnoiditis. Arachnoiditis is defined by persistent inflammation of the spinal cord arachnoid membrane, which closely wraps around the brain, spinal cord, and spinal nerve roots in a spider web-like fashion. Damaging neuroinflammation in response to injury triggers the migration of glial cells, ultimately resulting in the characteristic nerve swelling, scarring, and adhesions, with thickening and clumping of spinal nerve roots, which frequently progresses to neurologic deterioration and incapacitating sequelae. Symptoms may appear days, months, or years after the inciting event. Arachnoiditis is an acquired condition in response to a variety of inciting factors involving either physical damage or chemical injury to the spinal cord or infection within the spinal meninges. Diagnosis is based on history, individual clinical findings, and MRI features. Symptom severity and MRI imaging do not always correlate, however. Here on the left, you see the hallmark diagnostic MRI imaging signs of abnormal clumping and irregular distribution of spinal nerve roots in the lumbar area. Clinical presentations vary, as does natural history and timing of progression. While arachnoiditis is considered a rare condition, its exact incidence is unknown and likely underestimated due to the omission of subclinical cases. Individuals with connective tissue collagen disorders, such as those with Ehlers-Danlos syndrome, are well represented in the arachnoiditis community, and such individuals may have an underlying predisposition to develop arachnoiditis. Advanced stage adhesive arachnoiditis is characterized by intractable pain, significant mobility issues, myriad neurologic and multisystem impairments, all leading to long-term disability. CSF flow disturbances and fibrosis can lead to cord tethering, syrinx formation, myelomalacia, spinal cord atrophy, myelopathic symptoms, and recurrent CSF leaks. Complications can extend to endocrine, genitourinary, GI, and autonomic nervous systems, lead to autoimmune manifestations, and result in significant fatigue and shortened lifespan. Existing treatment interventions have variable results between patients and fall short, providing at best modest temporary symptomatic relief. Apart from its unrelenting neuropathic pain aspects, additional dimensions of isolation and suffering experienced by those with this condition are part of the daily lived reality for patients with arachnoiditis. These additional unmet needs which need to be better identified, characterized, and addressed, include long delays to diagnosis, averaging 4.8 years in a recent study, with patients seeing an average of 7.8 physicians before an accurate diagnosis is made. Due to rarity, physician education and training is limited, and patients often travel long distances to find an expert. This, plus difficulty in garnering sufficient interest on the part of the pharmaceutical industry and the medical community, remain significant challenges for initiation of evidence-based research. Patients not infrequently report dealing with the stigma of physician disbelief when reporting symptoms, with healthcare providers often looking for mental health issues or drug-seeking behavior to explain these. Diagnostic criteria are uncertain. Even when MRI images demonstrate signs which have been published as hallmark criteria of the disease, there was very poor overall inter-reader agreement, kappa score 0.51, among a panel of MRI neuroradiologists reading the same set of films in a 2021 study by El Hamsi and her colleagues. Finally, research into incidence, mechanisms, and treatment is made difficult due to geographic constraints and scattering of patients worldwide. Recent developments of bioregistries, online patient advocacy groups, video conferencing, and big data advances are beginning to overcome the financial and logistical challenges to understanding and treating rare diseases that existed in the past. In arachnoiditis, for instance, AI and machine learning, with its image and pattern recognition, might improve diagnostic accuracy and MRI interpretation. In our own group network, patients can find and engage with each other internationally, find a collective voice, validate each other, and diminish the sense of isolation. This interaction can be empowering, with members often greeting each other as fellow Arach warriors while sharing experiences. The recent launch of our International Arachnoiditis Patient Registry is a cornerstone of our vision. We are confident it will serve, with engagement of expert collaborators, as the basis for future clinical trials and peer-reviewed research. This slide visually summarizes the mission and outreach of ACMCRN, founded as a nonprofit in 2018. In addition to providing ongoing peer support activities, as well as comprehensive current educational resources for both patients and medical providers, ACMCRN seeks to lead an international research program inviting global arachnoiditis researchers to work together in a collaborative effort to advance quality evidence-based research into the condition. The next few slides describe the results of our initial project. Between 2021-22, ACMCRN implemented a series of health-related surveys within our international community, using the Stuff That Works platform and disseminated via a combination of targeted social media campaigns and word-of-mouth strategies. Stuff That Works is one of several crowdsourcing platforms specifically focused on rare and chronic conditions, with the aim of empowering people living with these conditions to transform their experience into an organized database. Individuals with the condition share information about themselves, how they experience the condition, its symptoms, aggravating factors, and treatments. Machine learning algorithms are then employed in an iterative process with stretch goals at each step to generate insights. After the first 100 contributors, initial insights emerge about age of onset, symptoms, aggravating factors, and various treatments. After several hundred, different treatments can begin to be ranked by effectiveness. And after thousands have responded, the algorithm can predict best treatments for the condition. Survey participation was entirely voluntary, confidential, anonymous, and online. After informed consent, participants were identified by only a code number for the duration of the study. Participants provided current age, gender, age at initial symptom onset, and were asked to list their most common symptoms, aggravating factors, comorbid conditions, and to rank 34 popular arachnoiditis treatments as either tried, effective, or detrimental. Feedback on aggregate results and insights was offered to all participants at the conclusion of the study. 1,250 individuals living with arachnoiditis responded to the survey. 76% were female. 78% reported initial symptom onset in early adulthood or adulthood, as shown in the pie chart on the left. The pie chart on the right shows current age of respondents at the time of taking the survey. The smaller graphic to the right on this slide shows the most frequently reported symptoms, including back pain, leg pain, numbness, headache, and a variety of other symptoms as noted here. Various types of overactivity, including lifting, as well as prolonged immobility, changes in position, and cold weather, emerged as the most common factors aggravating the underlying pain and neuropathic symptoms, as shown in the figure on the left. The graphic on the left of this slide shows how survey respondents rated the most common popular treatments for arachnoiditis as either tried, shown in yellow, effective, shown in blue, or detrimental, shown in red. It's interesting to note that the same treatment was frequently rated by different respondents as being either effective or detrimental, an indicator that there is variability in how different individuals may respond to a given treatment. Also of note, one can see that the treatments ranked as most effective in blue were rated as such by only 20% or less of respondents, indicating a need for more effective treatments. The graphic on the right singles out interventions or factors ranked as most detrimental in red bars, with myelograms and epidural injections being foremost among these. Among a list of comorbid conditions reported by survey respondents, arachnoiditis was second only to Tarlov cysts in patients who reported experiencing difficulty sitting. This study finding suggests that difficulty sitting should elicit consideration of arachnoiditis in the differential diagnosis of those presenting with this symptom. This correlation as a potential diagnostic marker and criterion merits further exploration in forthcoming registry studies. For any potentially interested future collaborators, this slide summarizes the key goals of our newly created patient registry. To build the registry, we've joined forces with Genetic Alliance's PEER platform, the acronym standing for Promise to Engage Everyone Responsibly. Importantly for ACMCRN, this platform is patient-centric, fosters community engagement in deciding which studies are of highest interest and priority, and keeps data ownership in control of the patient group rather than at an institution. In addition to ACMCRN-directed studies, we hope to partner with global arachnoiditis experts, allow the registry to serve as a tool that can be interrogated by interested research collaborators. In summary, this early attempt at employing AI and machine learning software platforms indicates that traditional burdens of recruitment in rare disease may be overcome with the use of virtual software. And when combined with the recruitment potential via disease advocacy and support groups, it exceeds past traditional attempts to recruit a sizable cohort. The authors wish to thank all of the arachnoiditis patients who participated in this survey. We acknowledge Stuff That Works for use of their platform, data aggregation, and insight analysis. We're grateful to Lou Cipher and Eve Blackburn for graphic design support and poster preparation. We would like to dedicate this presentation to the memory of ACMCRN co-founder and former VP of Research, Terry Lewis, PhD, who provided vital input into the concept and design of this study. Please be sure to also view our digital poster during meeting breaks. The QR code at the right side of the poster provides a link to our website as well as contact information for the authors. Thank you for your attention.